The Free State Education Department has embarked on a suicide prevention campaign targeted at schools. The program seeks to equip institutions of learning with practical tools for early at-risk individuals' identification of at-risk individuals and to promote mental health literacy and highlight access to psychosocial services. Now, the South African Depression and Anxiety Group finds that teen suicide accounts for 9% of all teen deaths in the country. Let's discuss this now with Director for Physio-Social Support in the Free State Education Department, Bukelwa, Qwelane, and clinical psychologist Dr. Keitumetse Mashego. Good morning, ladies. Thank you so much for joining us.
Good morning, Ms. Chava.
Now,
Good morning.
All right, Doctor, let me start with you. We're seeing alarming statistics that suicide is the third leading cause of death among young people aged between 15 and 29, right? Can you help our audience understand the scope of this crisis and what makes this September 2025 campaign particularly important?
It's very sad what, the statistics show because, suicide is now happening in, the younger, before it was, something that was not as concerning, but now we have pre-teenagers who are taking their lives. So you can imagine the crises that we are in. And ideally, for preventative strategies, it would be great if we could have screening by a psychologist, social worker, and even medically to check, because sometimes drugs and substance abuse is a problem. But, it's not always possible. But really, we need to do something. And it's not just the public schools, it's the private schools as well, where we've seen a rise. And the people who are attempting or who have suicidal ideation are younger and younger. And this is reflective, by the way, of what's happening in our society. What's happening with the kids is a reflection of where we are as society, where there's so many social ills and moral decay, and children are idling after school. They have nothing really to drive them, which is quite a sad state that we're in South Africa.
All right, and Bukelwa, can you explain what prompted the Free State Department of Education to launch this specific campaign right now? And what specific early warning signs should teachers and parents look for to identify at-risk learners?
So, Ms. Chava, what prompted the Department of Education is exactly that data that Dr. Tumi just alluded to. And having seen the national data, we then looked within our data in the Free State. And as it is now in this academic year, we had 160 learners that attempted. And of that, 4 completed suicide. So then that became a concern for us. And we then decided to embark on this campaign. And our campaign, really, we are concentrating more on the national theme, which is changing the narrative on suicide. And narrative on suicide is that people are keeping quiet about mental illnesses. There's also stigma around mental illness. So that's why then we had to embark on this campaign, engaging parents, engaging teachers, and engaging learners themselves.
All right, Dr. Mashego, now this campaign has the theme changing the narrative on suicide. Can you break that down for us, for our viewers in particular, what this initiative actually involves and how it will work in schools, essentially?
Sadly, there's still a lot of stigma, still there for seeking help, or someone who is struggling with mental health issues. And sometimes, the narrative out there is that it's a choice. I don't think anybody would choose to have a mental health challenge. And we need to understand that the stigma is not just, societal or familial, meaning the families and the society that judge people who struggle. But there's also a lot of self-stigma where people themselves who struggle stigmatize themselves themselves for struggling because they want to just snap out of it. So we really need to put out there that, some people are predisposed or at higher risk for suicide or mental health challenges, the same way someone is at risk for cancer and, physical illnesses. Like you can eat healthy, but still, develop things like diabetes because of your genetic predisposition. And it's the same for mental health challenges. And I'm glad that, the Free State is taking this initiative, because we really need to change the narrative about seeking professional help. And people often say we are expensive, we're not there, but we are there in the public sector, and really people need to, seek the help. The challenge with it is that one must see that they have a problem, or they must accept that they have a problem for them to benefit from the psychological intervention, which becomes a bit tricky sometimes. But really, we really need to continue to change this narrative around mental health challenges so that people do seek help and understand that it doesn't mean they're weak, it doesn't mean they're crazy, it's just brain wiring and neurotransmitters, where sometimes you do need medication, and some is chronic and some is short-term, depending on the diagnosis, but there is help out there.
Now, Bukelwa, how do you plan to address the stigma around mental health that prevents young people from seeking help? I mean, what referral pathways have been established for students who need immediate intervention?
Within our schools, we do have teachers that are earmarked to ensure that there is psychosocial support within the school. Those are the teachers that are able to identify, because they cannot really diagnose. But like you earlier asked me, what are the signs? They will be able to notice that suddenly this child is withdrawn. Suddenly this child maybe it cries easily, or is oversensitive. Or sometimes even kids that are so happy and, going all about, being popular in school, it doesn't mean those learners aren't under any emotional pressures. So as a department, we ensure that our teachers are trained on our psychosocial support policy, which also has a screening tool in it. And at district level, we have district-based support team. And at that level is where we appoint psychologists, we appoint social workers. So in the Free State, we have 5 districts, and in all our districts, we do have these services. So that is then the pathway, the referral pathway. However, we also work with parents. From these engagements, Mashaba, it came out that the home circumstances is the highest driver of suicide attempts. And when we engage parents, they were so vulnerable to us and open. They mentioned 2 things. Some parents, they said, we are raising these kids the way we were raised. And what does that mean? We were raised not to talk about your feelings. We were raised not to even articulate how you feel. So they are saying then they are raising these kids, meaning these kids don't have safe spaces, don't have places where they can, express their feelings, express what they are going through. So we are going to be involving parents, which we've already started, because they are the key role players in this. Conducive homes lead to mentally, healthy learners, or to learners that are psychosocially sound. So we are having a holistic approach in handling this matter.
All right.
Department of Health is also on board.
Okay, it's very interesting, Bukelwa, you mentioned something that's very important actually, that parents are saying that we are raising these children the way that we were raised. And now we're living in an era of conscious parenting, right? But I don't know if it's just me. Has the rate of suicide gone up, or do we just now know more about suicides because of the news and because of the advent of social media? I think I'll throw that to you, Doctor.
Unfortunately, it has increased because, as I said, and I think as Bukelwa has also alluded, parents are not coping. Parents are on autopilot. They don't know, they don't know what to do. Children sometimes who are verbal. So the kids of today are more verbal, yes, about their feelings. And you find that the parents also maybe might have struggled with depression traits, but it was never treated, right? Because remember, if it's a genetic predisposition, there's a likelihood that it's there somewhere in the family, or even if it's not to the extreme level it is seen in the children, but it might, exist there, but the parents push through, and now they're finding themselves parenting from a wounded place, or from a place where they are struggling, unaware, with children who are verbal about it, and because they don't know what to do about it, and they've never been exposed to psychological services, etc., then they don't know what to do with those children. But yes, definitely there's a rise, and also, in the era of social media, where we get people who take, have suicidal ideation, which unfortunately ends up with them, losing their lives. That it's put out there, and there's what we call copycat suicide, where children actually copy, some of the suicide attempts or suicide, the way in which someone took their lives who was famous, right? So we do get the social media era where, and I always say to people, social media is not a real place. People can post happy pictures, but be quite depressed. So, if you're functioning from a place of lack and seeing what people post, but also seeing the negativity that is posted out there, and that is internalized, it can definitely increase the risk of suicide. And what we have seen is an increase, especially in the young people.
All right. Now, as we wrap up the conversation, Bukelwa, if there is one key message that you want our audience to take away from today's discussion about suicide prevention among young people, what would that be?
It would be that suicide is preventative. So let us really ensure that we listen to each other. Let us ensure that we talk and we connect.
Thank you so much for your time, to the both of you ladies. Much appreciated. All right. That was Director for Psychosocial Support in the Free State Education Department, Bukelwa, Qwelane, and clinical psychologist, Dr. Keitumetse Mashego.